everyone. My name is Naisha. I am a medical assistant, and I'm also on the committee of the BCoD. And tonight, what I'm going to talk about is understanding maximizers and accumulator plans. And the reason why this is so important because it affects the cost of patients' biologics. So some of the things that patients should know is that the insurance plans features affects the copay assistance counting towards your deductible, out-of-pocket max. Another important fact is that patients patients can have a high cost medication like biologics. And then the goal is to help you and the patients understand the cost and the support options that will be available for patients, such as like copay card programs, patient assistance, foundations, and far as like for us medical assistants or biologic coordinators, the, the the support options that we need to rely on is our field reimbursement managers, our FRMs, or for other companies, the FAM, as they call it. Now, how they work is an accumulator plan does not count towards the deductible or the out-of-pocket max, which makes the biologics cost really expensive. It makes it really expensive. Now, like maximizers, it does count towards the deductible, but the problem is after one or two fills, the copay card is exhausted. And so the most important thing is that if a patient is aware of some of the plans that they're picking, it'll kind of help them to prevent unexpected expenses. The next slide, please. Now, some of the things that I tell my patients is that when you're picking an insurance plan, one of the things that you must know is you have to always read the fine print. And I know a lot of the times, the insurance plans, it may not tell you if you have like an accumulator or a maximizer plan. But I know one of the things that I do in order for me to find out is that once I call in that prescription over, let's say to Optum, I try to ask one of the pharmacists to do a test claim. And I make sure that I apply the copay card. Like if it's a commercial, I'll make sure that they apply the copay card. And let's say once the pharmacists come back after they do a test claim and they say, oh, it is around $2,000, then that already triggers me to understand that the patient may have either a maximizer or accumulator plan. And so sometimes I think the pharmacists, they actually do know, and I think they just don't tell you, that the patient has these type of plans, which is, to me, I don't understand why they don't tell patients, but I think I do understand why. It's because they prefer patients to pay the high copay. So another trick that I do, or tip that I do use, is that I try to talk to, as I was saying earlier, I try to talk to my field reimbursement manager. I tell patients too to track their expenses to avoid like surprises or see the next slide.
That is it.
And so I think another way that I learned how to understand if a patient has a maximizer or accumulator is because, for me, I have Caroline RX, and if a patient has Caroline RX, majority of the time they have a maximizer. and they would have to sign up. And what that means is that they have to sign up with the insurance company's mandated specialty program. And once the patient signs up with that specialty program will assist. They'll give them like their own copay card, which will be able to help them pay for their medication. So, like for instance, CVS, Caremark, Careline, a patient has to go through Prudent RX, or also another one that they have to go through is called optimization program. And the patient, they have to go and they have to sign them up. They have to sign up themselves, because I tried to sign up for a patient and they won't allow you to. So a patient has to sign themselves up. And like with Express Scripts or Cigna, for their Maximizer program, they have Save On Copay Maximizer plan, which is, once you send that prescription over to Accredo should be alerting the patient that they have to sign up with this program in order for them to have a $0 copay. There's no way around it. So if a patient let's say if a patient says, well, I don't know if I want to spend that extra 4 minutes, or I don't know if I want to call. If a patient does not call, then a patient will not get assistance from their insurance with this Maximizer. They have to call. And then like with Prime Therapeutics has their program. It's called Copay Maximizer program. MediImpact, they have the variable copay solution, which is, it's in-house. And then Nevada's Health Solutions, theirs is called Cost Plus Copay Optimization Program. And it's like a third party. So a lot of these Maximizer programs where the insurance mandate patients to go through, they're pretty much like a third party. They're a third party program. And for accumulators, so let's say if a patient has an accumulator plan, the insurance companies, they don't have anything that will assist patients with the cost. So you really do have to rely on, like the manufacturer company of these biologics to assist you, meaning that sometimes patients may have to sign up for the patient assistance, or you may have to go through foundation programs, or I think some of them, I know like AbbVie will sometimes give patients, and I think even Johnson & Johnson, they'll give a patient their copay card. So a patient will actually have 2 copay cards, so that way it'll be able to assist them and kind of get them through the year. And sometimes it'll get them through the year, and sometimes it won't, depending on the cost of the medication. For instance, I had a patient with an accumulator plan and they were on Tremfya. And so Johnson & Johnson, they did give that patient that extra copay card, but the problem was by the 10th fill, both copay cards was exhausted. And so sometimes too, I would say if there's samples, sometimes you may have to give patients samples. Even if they have like even a Maximizer or an accumulator plan, sometimes you may just have to, call on your local reps to give them samples, because it really is hard. And sometimes too, it really is even hard to determine which plan. Well, actually, I think it's kind of easy to determine like which plan a patient does have. Once you call in that prescription, and let's say even if the company or the pharmacy does not want to do a test claim, but once the patient calls you back and tell you, hey, I was only able to get my Tremfya one time, what's going on? Then you would already know that this patient has the Maximizer. Or, you know what, this copay card, the pharmacy is not accepting my copay card. It says it's 0. Then you know what? They may have an accumulator plan. So I think, once you listen to the patient's situation, you kind of can be able to determine on which route or which plan that they have. And once you figure that out, you can also, like I said, you can kind of reverse them into like, if they have that maximizer, you can reverse them to like some of their programs or even dig a little deep. I think sometimes for me, I try to call the insurance plan, or, once you get like PBMs, your PBM, I mean, not the PBM, I'm sorry. Once you get like a benefits verification, that's why I say too, it's always important to like fill out enrollment forms and look at the benefits verification. The benefits verification also too will kind of tell you, once you look at their like deductibles, and once you look at their PBM, it kind of can help you determine on like what the next step is with the patient. Because I know it kind of does get, frustrating on both ends, as a biologic coordinator and has a patient, because, once the patient is calling back and saying, hey, I can't get my medication, the pharmacy is saying, I need a prior authorization, or my copay card is not working, and you know in your mind like, hey, I added the copay card, or I know it should be some funds on there. I mean, so it kind of does get a little bit frustrating when it comes to these plans, because sometimes, in some cases, you just run out of options. And I know I had a patient where I did run out of an option, is where everything was exhausted at 6 months, and she wasn't eligible due to her income to get the foundation. No, she wasn't eligible to get the patient assistance, and then the foundation program sometimes, they're kind of full and they're not accepting patients. So it really is hard. And the best solutions that I have is that you really do have to lean on, like the reps. You have to lean on the FRMs. You even, try to educate patients on specific plans that they're picking and understanding their plans. And even as a biologic coordinator, you have to kind of understand, the insurance plans, because it really is difficult. And all I know is that, we want to help the patients, and sometimes it really is hard because of, these insurance plans. They put up a fight. They don't want to help patients pay, for anything. And honestly, I know in Illinois, it's illegal to even have accumulator and maximizer plans. But what I see now is that a company, let's say a company could be based in Wisconsin, but the patient works in Illinois. So now they have that Wisconsin plan, which makes it legal for the insurance to give an accumulator or maximizer plan. So that's pretty much now what is happening, and that's why accumulator and maximizer plans are really starting to hit the market so tough, because companies are going around it because it's cheaper. They feel like it's cheaper, but it's really not, because it's affecting patients' health, because it's stopping patients from, getting these biologics or getting certain procedures or other medications that they need. And so that's why it's kind of like where we come in, into where we definitely have to dig deep and try to find other other resources to help these patients stay on therapy. So that's pretty much my intake on the maximizer and accumulator plans. Is there any questions or? They don't want any questions. What PBM usually have accumulators? So I don't think it's the I don't want to say it's a certain PBM that would have an accumulator, because what an accumulator does is it pretty much stops the patient from using like the copay cards, and it won't count towards the deductible. So you know how a lot of the copay cards, once patients like use it, it counts towards their deductible. So accumulator kind of stops that. So a patient, they're not able to use the copay card. It kind of just exhausts the copay card automatically. They can't even use it at all. So I think it just depends on the plan that the patient has, and like I say, you will be able to determine once that patient calls and say, hey, why is my copay card not working? And then automatically, it might trigger you to say, you know what, I bet you they have that accumulator plan. Let me call the pharmacy to see, what's going on. And then that pharmacy will kind of say, well, you know what, the copay card is exhausted. They're going to have to find an alternative to pay for their medication. And so that's kind of how you'll kind of determine if that patient has an accumulator. And you'll probably have to try maybe like patient assistance or like foundations, or like I was saying previously, you may have to contact like that specific manufacturer company and to see if they can give that patient that extra copay card, because a lot of them sometimes will give patients the extra copay card so that way they can continue on their therapy. And I thought there was another question, but I don't see it anymore.
So Naisha, in short, the copay card helps you pay, but the insurance acts like it doesn't exist.
We say that the copay card.
So in short, kind of like the copay card helps you pay, but the insurance acts like it doesn't exist.
Correct. Yep, that's exactly how it is with the accumulator. Yep. The insurance blocks it and acts like it doesn't exist. Yes.
And then the maximizer is like the copay card helps pay for the meds and counts towards the insurance limit, so it can hit the limit sooner.
No, so what happens is that if you have like a maximizer, the problem is that those insurance companies, it'll help cover some of the costs, but then the patient is pretty much left with a high cost. And so like when you have a maximizer, you have to the insurance company wants you to sign up with their copay, their own, because it's kind of like they have their own copay card. So a patient, they have to get registered with their whatever the company uses. Like for instance, Caroline RX, they use Prudent RX. So if you don't get signed up with their copay assistance program, then you won't pretty much get help. They won't cover the rest of the cost of the medication. So like once a patient has a maximizer plan, then they definitely, there is a third party that is involved that they have to sign up with. And there's no way around it, because if they don't, then they're going to definitely have a high cost for the medicine.
So there is questions in there by Sarah. It says, I have been told by Sendera they also have a foundation assistance. Patch is Sendera has to fill a script. What does that mean, Sarah?
Yeah, what is that? I am told by Sendera they also have a foundation assistant. Catch is Sendera has to fill a script. So are you saying that I don't use Sendera, so I that they have their own. So are you saying that they have their own like assistance for patients that have like high cost for copays?
Yes.
So also, yeah, so even some pharmacies, they do have like certain options for patients, and that they can be able to assist patients with. Yep, they surely do. You just have to figure out, which ones does have it. But again, like Sarah was saying, they have to fill it with Sendera, though. That's the only catch, which honestly, I feel like that's not a bad thing, because if they're helping you, cover the cost of these high copays, then of course, why not, fill your prescription with Sendera if your plan allows it, because you know how some plans, they're mandated to a specific pharmacy.
Okay,
And
Anna
then,
is asking, oh, sorry, go ahead.
oh no, I was going to read what she says. I think someone says the difference between the accumulator and a maximizer, and is one better than the other one. So if I really have to choose, I would say I would rather have a maximizer, because a maximizer, the copay cards, they still count towards the deductible. The problem is that the patient they'll reach the cost quicker. An accumulator is that the copay cards does not count towards the deductible, in that the patient will still have a higher cost for the medication. So patients, basically, they can't use the copay card. So if I have to pick, I would rather have a maximizer plan, because, again, majority of the maximizer plans, they have a third party that they have to go to, where they can sign up for that third party's copay assistance, which will help them with the high cost of the copay. So I would personally rather have a maximizer versus an accumulator. Oh, Sarah wants to talk. I'm sorry. Sure. Go ahead. Hello? Did it cut out?
Oh, I don't know. I don't know if but Anna was asking, can patient opt out mid-year of these programs?
No, because it's with their plan. So no, they cannot. They have to. There's pretty much nothing that they can do, unless when it comes to like changing an insurance, and then they can kind of like see like what their insurance, like they can pick a different insurance. That's what they can do, but they gotta hope that they don't run across this again. So no, they can't opt out. And then I know somebody was asking. Her name was Maylene. Like, what's the difference in between the accumulator and the maximizer, and which one would be better to have? So again, accumulator copay cards do not count towards the deductible, and they end up having a higher cost. Maximizer, the copay card does count, but the copay card gets exhausted pretty much quickly. And so, again, as I was saying, I would prefer to have a maximizer, because maximizers, they have a third-party option, a third-party company that's, well, once you sign up with them, they'll help you with the copay. So that's the one that I would prefer to have, is a maximizer, if I literally have to have one. And then I know Sarah said she wanted to talk, which
it didn't
you
work.
welcome,
It doesn't work.
You welcome, Maylene. And so Sarah, sure, Sarah can talk, because I love when Sarah talks.
She said it doesn't work.
Wait, how does it not work? I don't know how to work it. Let me see. No.
And it looks like Ginny here have a good resource. So whoever sees that.
I saw that. Yeah, allcopaycount.org. Yeah, I screenshotted it, so I'm definitely going to look into that. And Sarah says Abby has a dual copay card and savings card that counts towards the deductible. Yes, Abby has a great option for patients. I love it. Hi, Catherine. So again, I just say, hey, for these plans, just be on the lookout, and kind of pay close attention to like your patient's situation when they call, because that way you'll be able to understand or know like which route you would need to definitely go. I know it's going to be, it is, especially I would say the hardest plan is I feel like it's the accumulator. I feel like that's the hardest ones to deal with, because you have to really pretty much try to put a patient on patient assistance or foundations or try to find other alternative options. I think that's the hardest one for me, is an accumulator. But maximizers, I think, are not too bad.
So Anna here is asking you, Naisha, would you be able to send me the list of the plans that have them to pick as a reimbursement option for patients that have those plans instead of the copay cards?
Yes, if she puts if she puts her email in, I'll like screenshot it, and then once I get to work, well, if I don't send it tomorrow, because tomorrow's Wednesday, I may send it Thursday, because we're gonna have like a ice storm out here. Yeah, we're getting hit with so much bad weather that it's insane. So, yeah. If anyone wants the list of like the maximizers ones, I can definitely send it to you. Yep, put in your let me see, I'm screenshotting that now. So I have your email.
I sent the email.
And I just screenshotted the allcopaykount.org, because I'm definitely going to check that out. And if anybody else wants the list, oh yep, I'm doing that now. I got it. Hold on. All right, perfect. I screenshotted it, everybody's email, and I'm definitely going to get that sent out. So that way it'll be able to like kind of help. Oh wait, there's another person. Hold on. Perfect. I'll get the list to everybody by this week.
Awesome. Oh, Anna made a comment and said, I've run into so many accumulators recently. I started lugging it in my spreadsheets and in the patient's charts. Sorry, I'm texting as my brain works.
You know what? Honestly, that is a good way to track them. Thank you, because you just gave me a tip. I think that's how I'm going to start maybe tracking mine, because it's like I say, accumulator plan. I just feel like it's so hard. They're really tough to work with, and I feel bad for a lot of patients because there's not, there's a few options that can help them, but it's kind of like not so many. So definitely accumulators are hard. I know that, you know what, that is a good idea to add them to I never even thought about that. Add it to the sticky note. See, this is why I love that we do this.
Yep.
Sarah's awesome. I'm mad, Sarah. I don't know how to unmute this so I can hear you talk. I don't know how to do that. Nope, I don't know how to do it. Let's see. Hold on. Oh, wait. No. Yeah, I don't know how to do it. No, sorry. I'm still trying to figure that out, but yeah. I guess I'll figure that out another time. No, thank everyone. Everyone had like such good questions. Everyone had great such tips, and I'm so glad that we do have these webinars, because it's like I've learned a lot from other people, from like everyone. I mean, everybody has great ideas, and I think this is such a great thing that is being done every month, is that we get together for like webinars and listen to everyone's input and suggestions and ideas. I think this is like such an awesome thing here. The way, hold on. That way, let's see, hold on. I have a golden rule U.S. sales that allows $1,000 per fill. Whoa. That way, if I see any other similar plans, I can head them off before the first fill or before they get. Yes, because Accredo, oh my God, I thought it was just me. Accredo will definitely, and I think Accredo, to be honest, and I think Accredo does that on purpose. Like Accredo knows when these patients have these maximum, when they need to sign up through the third party, or if they have an accumulator plan, they know that after the first fill, and they don't even tell patients. They still send out the prescription anyway without even consenting with, not even getting patients' consent. They send out the medication to the patient, and then like a few weeks later, they send out the bill. Like, yes, yes, Accredo is so horrible. They are so horrible. Yes, yes, that is the very true. Accredo does that all the time. I mean, you know what, Catherine? It actually, again, these programs are illegal. But I was just saying earlier is how companies get around it is that, let's say your derm office. Okay, let's say your derm office is corporate, maybe corporate or not, I don't know. But let's say it's corporate, and the main campus is in Las Vegas, but they also have one in Illinois. And let's say I'm working for the Illinois one. So what they do is they buy the insurance in Vegas, and then they give it to the employees that are in Illinois, Texas, or wherever they're stationed at. And so that's how they kind of get around it, is because they have the out of state insurance plans. So you kind of can go around it, because I know in Illinois it's illegal, and I think in Wisconsin too it's illegal. But yep, they kind of get around it by just providing out of state insurance. So that's how they get around a lot of this stuff. And so that's why they have us, so we can fight harder. Wait, let's see what it says. It says I was trying to get scripts transferred for plans added to allow them to bill even when they have existing prescriptions anywhere else. I think how should I do it? I think I have seen that before. So, but I wonder though, when I see that, I think I see it because their PBM is changing. I don't know if it's per se of them trying to actually get them to fill when they have something somewhere else. But you know what? It possibly could be that, but I haven't seen that yet. Hey, they may be. Got to be careful. I got a bunch. They were triaged by the insurance. Don't send them until the first. They still can't fill it. Yeah. Yep. Yep. And I noticed now to that though. A lot of I know a lot of PBMs. I think I just got one today where they were with CVS, but then it kind of out of nowhere it kind of switched over to actually Caroline RX. And Frito off there. Ooh, wow, that's something interesting that I didn't know. Whoa, that's a good thing, I think. So wait, so who has Prime Therapeutics now? I didn't hear that one yet. Fair, wait, Anna, who has Prime Therapeutics now? Does anybody know? Depends on the drug. I have a list. I can share. Yes, that would be awesome, because I didn't even know that Accredo lost his contract with Prime. I mean, I'm can't say that I'm sad, because Accredo has been horrible.
No, I thought I just did a Prime, and it was through a creek.
Maybe it takes place.
Maybe not yet in this year. Maybe
Yeah,
early next year. Maybe.
yeah, yeah, maybe so. This was pretty interesting and good.
Mhm.
Very interesting and good. Oh my God, it's like 7:05. God, we've been talking and haven't even paid attention to like what time it is. This was like a good topic too. very good topic.
Always.
I feel like once we all get together, it's always a good topic, and we all can relate because we have so much, and we see so much, and our main concern is we want to make sure that the patients are pretty much getting a fair shot, because I feel like patients are not getting a fair shot because everything with insurance is so tricky, and if you don't read the fine print, or if you don't do this or if you don't do that, then a patient, they can lose their chance of, staying on their biologic or even getting a biologic these days, because the insurance, they put up such a fight and they make it harder day by day. So, is there any other questions or suggestions, or? Can I get called my Dupixent FRM, and she said, just get a notice for 1/1. It's changing. Wow, that's actually big. That is very big. Well, I'm definitely looking forward into the changes for the new year and see what's going to happen. Let's see, it says I had a Central Well patient that billed the patient $3,000 deductible for Evercliff instead of billing Humana for Medicare. 3P. Hold on, let me make sure I understand this. I had a Sentinel patient that billed, a patient that billed $3,000. Deductible for Evercliff instead of billing Humana for Medicare. Oh, are you saying trying to understand this question? What is the cap and smooth? Which that's another tricky topic too, the cap and smooth. Are there any other questions? I know it's 7. I know everybody, I don't want to keep everybody too late. Well, perfect. I thank everybody for joining in, and again, I enjoyed. And again, I will get thank you guys, and I definitely will get the list out to you guys so that way you'll have that information. So I appreciate everyone. Thank you guys.
Good night, everybody.
Have a good night.